All right, we'll go ahead and get started. So good afternoon, everybody, and happy holidays to you all. Welcome to today's webinar, sponsored by the Association of Schools and Programs of Public Health, or is more commonly referred to ASPPH. I am Monica Statler, Director of Applied Learning and Training here at ASPPH. And the purpose of today's webinar is to share information about fellowship opportunities sponsored by ASPPH for soon-to-be graduates and recent alumni of our member CEPH-accredited schools and programs of public health. I'm delighted to be joined by my colleague, Sierra Sledge, our Fellowship Program Manager. Sierra will help me lead today's presentation. Moving on to our agenda, during today's webinar, we will share information about fellowship opportunities at 3 federal agencies: the USDA Rural Health, the U.S. Environmental Protection Agency, or EPA, and the Centers for Disease Control and Prevention, or CDC. Before we start, a few housekeeping details. If at any time during the webinar, or at any time during the webinar, you may type your question into the questions box, which you can find on the toolbar on your computer screen as shown here. We will address all questions during the question and answer session after the formal presentation. Now to begin. The Association of Schools and Programs of Public Health, known as ASPPH, is the voice of accredited public health education. We represent schools and programs accredited by the Council on Education for Public Health, or commonly referenced CEPH or CEPH. ASPPH is pleased to partner with federal agencies, including the EPA, the CDC, and the USDA, to offer public health training opportunities for students and recent graduates for our member schools and programs. Now, you might ask yourself, what distinguishes the ASPPH training programs from all of the other fellowships out there? First and foremost, with over 40 years of training program experience, ASPPH provides highly respected and recognized mentor training programs specifically aimed at fostering the growth of early career public health professionals. We have time-tested relationships with federal agencies that are involved in public health, such as CDC, EPA, and USDA. The performance of our fellows speaks for itself, as many of our program participants go on to become full-time employees, or FTEs, and contractors at their host agencies. In addition, as an ASPPH fellow, you become part of a network of nearly 2,500 ASPPH fellowship and internship alumni who are public health leaders in the private, nonprofit, academic, and government sectors. Wherever you are in your career, you can always contact ASPPH and ASPPH fellow and intern alumni for networking, advice, and support. ASPPH fellowships are applied learning and training programs that provide effective, practical preparation for early career professionals through the enhanced interplay between the didactic educational experience and fundamental public health concepts and real-world experiences that enable our students to apply those concepts. Our fellowships are long-term training assignments that are typically 1 to 2 years, and in some circumstances, 3 years. Fellowships are open to recent graduates, defined as students who will have received a master's or doctorate degree by the start of the fellowship, or alumni who have graduated within the previous 5 years of the start date of the fellowship. Applicants' degrees must come from ASPPH member institutions. So even if your program is CEPH accredited, if it is not an ASPPH member, then you're not eligible for ASPPH training programs. Now, during this presentation, we will focus on ASPPH opportunities that are scheduled to begin in 2025 with USDA Rural Health, the EPA, and the CDC. Now, to reiterate, to be eligible for ASPPH fellowship programs, applicants must have received a master's or doctorate degree from a CEPH-accredited school or program of public health that is a member of ASPPH. The graduate degree must have been earned prior to the beginning of the fellowship and no earlier than the previous 5 years. Now, we're often asked if you must have an MPH degree specifically, or if it's okay to have an MSPH or MHS, for example. Now, the answer depends on where you received your degree. If you attended an ASPPH member school of public health, then any graduate degree received through the school is acceptable. If you attended an ASPPH program of public health, only those degrees conferred that are accredited by CEPH are eligible, and this will vary by program. The same principle applies to doctorate degrees. They must be from an ASPPH member CEPH-accredited school or program of public health. Now, all applicants for ASPPH fellows must also be U.S. citizens or hold permanent visas for residents in the U.S., i.e. have a green card to be eligible. For international students who are on today's webinar, we strongly encourage you to check with your school's Career Services Office as well as the ASPPH website, publichealthjobs.org, to find opportunities for which you might be eligible. You may also research opportunities available for international students directly through the federal agency in which you are interested. Fellowship assignments are 12-month placements. Some ASPPH programs offer extensions for a second and possibly third year based on the availability of funding at the host agency, the satisfactory progress of the fellow, and the desire of the fellow to continue. Fellows receive a training stipend, an allowance for health insurance premiums, and in most, but not all cases, a travel and training allowance. The stipends and allowances vary by program and fellowship location. All fellows are required to establish goals and objectives that they will accomplish during their placement. These goals and objectives are established in collaboration with host agency mentors and are reported to ASPPH at the beginning of the fellowship. Fellows then report to ASPPH and their mentors on their progress in accomplishing their learning plan throughout the assignment period. At the end of the assignment, each fellow is required to submit a final report and assessment. We're excited to announce new fellowship opportunities that will begin in 2025 with the ASPPH USDA Rural Health Fellowship Program, the ASPPH EPA Environmental Health Fellowship Program, and the ASPPH CDC Public Health Fellowship Program. The ASPPH USD Fellowship application cycle is currently open. The deadline is January 9th. The ASPPH EPA Fellowship application cycle opens tomorrow. The deadline for that program is January 29th. And the ASPPH CDC Fellowship will open on January 23rd, and the application deadline is March 13th. These deadlines apply to all fellowship materials, so letters of recommendation and faculty advisor verification are also due on these dates. So be sure to keep this in mind as you proceed with the application process. And we'll discuss a little more about that in just a few minutes. Now, let's talk a bit more about each of these programs. The goal of the ASPPH USDA Rural Health Fellowship Program is to provide opportunities for fellows to contribute to USDA programs related to rural health, lead the development of tools to better understand and access USDA programs that federal and non-federal partners can use, to prepare and implement rural health initiatives with USDA programs and federal and non-federal partners, and build for federal and non-federal partners. The fellowship is based in Washington, D.C., but remote candidates are being considered. The position will begin in mid-June of 2025. The goal of the ASPPH EPA Environmental Health Fellowship Program is to provide professional training and opportunities for early career public health professionals to be involved with EPA on current and emerging environmental public health needs. The program provides fellows the opportunity to train under nationally recognized experts who work to protect human health and the environment at a national and international level. Potential training areas include public health and climate crisis, environmental justice and civil rights, clean and healthy air for all communities, safety and chemicals for people and the environment, and children's environmental health. Fellowship locations are primarily in Washington, D.C. and Research Triangle Park, North Carolina, but there are occasional opportunities open at EPA regional offices. The 12-month placements are expected to start in October of 2025. The goal of the ASPPH CDC Public Health Fellowship Program is to identify new approaches and opportunities for field experience in which recent graduates and early career professionals with graduate degrees can practice applying skills and knowledge learned in the classroom to real public health practice. A competency-based core curriculum creates a foundation through which fellows develop the skills they need to offer essential public health and population health services while learning from CDC's leading experts in the field. ASPPH fellows have gained invaluable experience through their direct contributions to fighting a variety of public health emergencies, such as H1N1, Ebola, and of course, most recently, COVID-19. Fellowship locations are primarily in Atlanta, Georgia, but in some circumstances, remote placements are allowed. The positions will begin in mid-September 2025. Now, I can tell you more details about these programs, but the best people to describe them are those who are experiencing them. So we're thrilled to be joined today by 3 current ASPPH fellows. Tamara Tells, currently a Rural Health Fellow at USDA Rural Health, is based here in Washington, D.C. Meera Joshi, currently an Environmental Health Fellow at EPA, also based in Washington, D.C. And Michael Vega, who's currently a Public Health Fellow at CDC, based in Atlanta, Georgia, but he works remotely from Chicago. We will now hear from each of the fellows about why they chose the ASPPH Fellowship, what their fellowship involves, and some tips on how to strengthen your own application. We'll start with Tamara. Tamara Tells is a graduate of the University of Reno School of Public Health and is an ASPPH Fellow with the USDA Office of Rural Health. Welcome, Tamara.
Thank you, Monica. Hi, everyone. Like Monica mentioned, my name is Tamara Tellis, and I am the current ASPPH USDA Rural Health Fellow. So why this fellowship? It's a really great opportunity to launch, or in my situation, relaunch your career. It's an opportunity for professional development. This fellowship provides a lot of great networking opportunities, especially if you make the move to DC. There are new experiences to develop your skills and better understand the federal system. It's a chance to explore a career in the federal government and for a career advancement. With this fellowship being the first of its kind, it was a great new challenge that allowed me to build something from the ground up, create structures and processes, something that the next fellow can continue to build off of. And of course, personal growth. So taking on something new with uncertainty and moving across the country was a great experience and something I would encourage anyone to do. Next slide, please. So what this fellowship entails. The ASPPH USDA Rural Health Fellowship is unique in the sense that you are positioned in a place within USDA to work across the entire department, which USDA is very large. It's, that's including their mission areas, their agencies within those and offices within that, but also working with other federal partners, specifically HHS. Some of the areas within HHS that I work with a lot is HRSA, SAMHSA, CDC's Office of Rural Health, CMS. I do a lot of work with the VA and other national partners that are not in the federal government. It is a team of just you and the USDA Rural Health Liaison, which is a position that was appointed by Congress in the last Farm Bill, because we don't have the new one yet, so the 2018 Farm Bill. This fellowship lives within USDA's Rural Development Mission Area inside their Innovation Center, which is actually really cool because it's the only innovation center in the entire USDA department. On the slide is a list of different projects I've worked on or have developed. There's a lot more, but these are ones I really wanted to highlight just because they have been extremely beneficial. They're also going to be continuing on for the next fellow, or most of them will. And then lastly, a huge part of this role is continuing to develop your soft skills. It's a lot of different like administrative work within the federal government, because we are doing that upstream approach. We're not on the ground doing different public health work. We're, building it for everyone else to utilize and break down. So, but also to be able to really support the rural health liaisons' ideas and direction, and to turn it into something really, really real. A lot of this fellowship, because it's new and the rural health liaison position is fairly new, is being able to come up with ideas and processes and anticipating what comes next that's needed. So whether that's, developing slides for presentation or talking points for somebody else in the undersecretary's office, or a standard plan for reoccurring events. Also, being able to just dive in and take something on when the rural health liaison doesn't have the capacity. It's important that this fellow also feels really comfortable in representing USDA, especially like rural development at different events or meetings. Next slide, please. So how to make your application stand out. I think one, having passion for rural and what it means to you is important to highlight. Any personal and or professional experiences with rural health and rural communities is important to highlight as well. And also, what do you want to gain from this experience? For the most part, that is what I did. I shared my journey and how everything I have worked on towards, like really brought me to this opportunity. I have rural and global health experiences, so I highlighted how that work and those experiences have really supported me in better understanding why I want to be in rural health. I highlighted how that work and the skills I had developed put me in a great position to take on this fellowship. So with that said, I think the skills and experiences that will help you stand out are, having that understanding of social determinants of health, their impacts in rural communities, especially economic development and cross-sector collaboration, having understanding, experience, or at least some knowledge under mental and behavioral health, especially how they influence or the challenges that rural communities and tribal communities as well face. Building and maintaining relationships, public speaking and developing slides and talking points, conducting mixed methods research and data analytics, being proactive and being good with time management, and of course, project management and or event coordination would be key. Thank you.
Great. Thank you so much, Tamara. And we're now going to hear from Mira Joshi. Mira is a graduate of the University of Michigan School of Public Health and is an ASPPH fellow at the EPA. Welcome, Mira.
Hello, everyone. Lovely to be here today. So first, I'm just going to talk about why I chose this fellowship. So towards the end of my master's, I knew that there was going to be a transition working in the real world because I went straight from undergrad. And it felt like going into just a full-on job was very abrupt for me. And then I found this fellowship position, and it's a nice transition that'll help me work in the real world because I still get to do the learning and education through conferences and trainings and other ways to get information. But I also have responsibilities that would be expected of me in a real job. So I feel like it has made the transition into the real working world a lot smoother. And also, you get way more professional development opportunities, in my experience, than any of the other positions I was considering that weren't fellowships. I also thought it'd be really, really interesting with my master's degree to work in a federal agency. My master's of public health is in environmental health promotion and policy. And a big part of what we do centers around what EPA does. So seeing the inner workings of the EPA has been very, very cool. And it's helped me understand more of like the inner politics and just, especially being in DC, what goes in to developing a program. And then in addition to that, like I mentioned, there's lots of conferences and things. So there's a bunch of networking opportunities. There's mentorship programs at EPA. All of my mentors have been very, very helpful and are always willing to connect me with anyone if I have questions. And also because you're taking on some responsibilities of a real job, but you still get to network, you get to kind of experience different kinds of jobs. So I've worked with different offices within the EPA, and I get to kind of have a perspective of, okay, this is what the Office of Water is like, this is what the Office of Air is like. So I think that's been very, very unique. And in terms of the projects that I'm working on, one of my biggest projects is helping. There's an interagency effort to develop a scientific integrity survey to make sure that all agencies that do scientific work are incorporating scientific integrity practices into the projects that they do. And so I'm helping create that and disseminate the survey. Another project I'm working on is working more at the local level as opposed to top down with programs to ensure that they're integrating equity into each stage of the program evaluation and the evidence building process. And this is due to requirements from the Evidence Act, which there's a ton of information on that, but that really governs the work that my office does. So I really like that I get to help implement that. And then further with the Evidence Act, I get to help with the development of EPA's learning agenda, which is done every 4 years in tangent with the strategic plan. So really just getting to oversee how the agency is going to guide their work now and in the future has been really, really cool. And that's an experience I probably wouldn't have been able to get anywhere else. If you want to go to the next slide, Monica. Yeah, thank you. And so in terms of how to make your application stand out, the biggest thing I found is that you need to have a convincing argument, almost you could call it. You need to have a clear what, why, and how. What are your career goals? How will the position help you achieve those career goals? And how will you use this position to further advance your professional development? So people don't just, like the people who are interviewing, don't just want to, oh, this job is nice and I like it and I want to do it. They want to be like a very much have a good case. And I put a mission statement as an example below. This is one that was kind of workshop from what I developed when I applied. I applied to a couple of the different fellowships, and one of them was on climate change. And so I talked about how, my first sentence is about how my degree will help me implement that knowledge into the work I do. Then I talked about the projects that I worked on that give me practical experience. And then I talked about how this relates to the current laws and regulations that govern the work EPA does. So really just having a very cohesive argument as to why you are the best candidate for the position. And then, along with that, making sure your application stands out by saying all of these specific details, like talking about my specific master's, talking about the specific project I did, not just that, like, oh, I worked on things. Saying exactly what you did is very, very helpful from what I experienced. But yeah.
Terrific. Thank you so much, Mira. And we're now going to hear from Michael Vega. Michael is a graduate of the St. Louis University College for Public Health and Social Justice and is an ASPPH fellow at the CDC. Welcome, Michael.
Thank you, Monica, and hi, everyone. Like Monica mentioned, I'm an ASPPH fellow on a health education track at the CDC. I'm based in the National Center for Emerging and Zoonotic Infectious Diseases, working out of the Office of the Director on 2 teams, one being the Health Communication Science Office, and the second being the Social Behavioral and Evaluation Sciences Office. So I had a similar journey as Mira, where I completed my undergrad and my graduate experience in 5 years, and I knew that I wanted an opportunity to continue building on some of those skills that I had been learning in the classroom. And I knew that an ASPPH fellowship would kind of give the ideal transition period into the public health workforce. Specifically, I chose an ASPPH fellowship because I knew it would offer a unique opportunity to align both my passion and career goals. And as someone who's dedicated to reducing health inequities and promoting culturally responsive communication, this fellowship provided the perfect platform. Moreover, the chance to work at NCEZID allowed me to address critical issues on a wide range of topics, such as preventing mosquito and tick-borne illnesses to designing health education materials. And beyond this mission, the fellowship offers unparalleled professional growth, enabling me to build skills in emergency preparedness, partner engagement, and culturally competent messaging, all while contributing to meaningful public health work. Next slide, please. So my fellowship revolves around health communication and education, research, and evaluation. One key focus is creating culturally tailored messages that resonate with communities. And during my first year at the agency, I've supported community engagement and communication projects on topics ranging from dengue in Puerto Rico to Mpox here in the US. On the research side, I've designed and analyzed several surveys, including leading the development of a 20-item survey of over 500 respondents to gather information on insect bite prevention behaviors, all in an effort to inform our center's public health strategies. And lastly, collaboration is also a central part of my role. I've worked cross-divisional teams, supported social media strategies targeting Gen Z, and partnered with vendors to ensure that our communication materials are evidence-based and impactful. Next slide, please. So a couple of tips to make sure your application stands out. It's important to tailor every section of your application to the fellowship's mission. For example, if you're passionate about global health or health equity, it's important to make that clear and stand out in your essay. It's also really important to highlight your unique skills. In my case, I emphasized multilingual abilities and unique global health experiences, and these demonstrated my ability to address diverse audiences' needs effectively. And finally, it's important to be strategic, to use clear and concise language in your essays, and ensure your resume reflects measurable outcomes from previous roles. And strong recommendations from mentors who can vouch for your leadership and adaptability will also make a huge difference. Thank you.
Thank you so much, Michael. And thanks to all the fellows for sharing your insight and experiences with all of us. Now I'm going to hand it over to my colleague, Sierra Sledge, who will tell you about the ASPPH online application system. Sierra.
Good afternoon, everybody. So like Monica said, I'll now talk about the application process. So in order to apply for a fellowship, applicants first need to create an account in the ASPPH application portal if you don't already have one. For those of you who already have an account in our system, you can also sign in from this page. To begin, there are 5 main components of the application package. First is your CV or resume, then the 2 letters of recommendation, which are specific to the program which you are applying to. Suggested references are individuals with whom you have built a substantial relationship with, either through school, public health practice, volunteer or community service, or another professional experience. The individual should be able to effectively address your skills, qualities, and personal attributes. It's critical to select references who can speak well to your assets and abilities that make you a strong candidate for the fellowship program. A graduate transcript from your school or program of public health is also required. For the application, you may submit an official or unofficial transcript, but if you're selected for a position, then you must provide your official transcript before you can officially begin the fellowship. In addition, ASPPH now requires applicants to complete 2 essay prompts, unlike years prior when there was only one. The first prompt is specific to the position in which you are applying to. So if you apply to only one position, you only need to submit 1 essay. But if you apply to 3 positions, then you will need to submit 3 essays. The second prompt will be specific to the program in which you are applying to, CDC or EPA, for example. This will include only 1 essay. In this essay, you will explain your personal and professional interests, strengths, qualifications for succeeding in this particular fellowship assignment, and how it will benefit your long-term career plans in the field of public health. In both essays, you should be sure to highlight your unique lived experiences and special attributes. Special consideration will be given to candidates who have been exposed to a broad array of life experiences and viewpoints, who can bring diverse perspectives and experiences to the fellowship project areas, and focus on public health in general. You will also need to provide your faculty advisor information. This is only for applicants who have not yet graduated or whose transcripts do not show your graduation date. So an advisor will just need to verify your graduation date. And then finally, if you are not a U.S. citizen, but instead a permanent resident, you'll be asked to indicate that in your application. Both green card holders and U.S. citizens will be required to provide proof of citizenship or residency status if they are offered a position, as all fellows are required to go through a federal security clearance process. I will now provide a walkthrough of how you can use the ASPPH application portal. The first step in applying is to visit the ASPPH Fellowship Application Portal at fellowships-internships.asppph.org, and this link is available on the main fellowships page of the ASPPH website. You may log in or sign up for a new account directly from this page. Once you have logged in, you will come to the home page of the ASPPH application portal. This page shows any open applications at the top, including the application deadline and a link to view the full program announcement. The program announcement is the most important resource you will have when applying for a fellowship. I cannot express this enough. We strongly recommend that you review the entire program announcement before starting an application. This includes detailed information about how the fellowship program, open positions, eligibility, application review procedures and criteria, timelines, and how to apply. As mentioned, this will include all project descriptions for the available fellowship positions. It is essential that you review this information to determine which positions are the best match for you. The homepage also includes some quick information and links to additional resources, including a My Status section, which is shown here on the slide. Once you have submitted an application, you can track the progress of your application in this section. You can also find a user's manual with step-by-step instructions on how to apply at the bottom of the page in the resources section. Under the My Status section, you will also see if your recommenders and/or advisors have submitted their required materials for you. If you see that they have not yet submitted their pieces and the deadline is approaching, we suggest you reach out to them with a friendly reminder. You'll see here that there are 5 steps to complete and submit your application. Step 1 is the My Profile page, where you'll enter your personal and contact information. Please be sure to use a permanent email address for your application, since this is the email ASPPH will use to contact you about your application throughout the entire process. So, a school email might not be the best option if you will lose access to it after you graduate. Step 2 is My Education, which is where you will enter your degree information and also upload your resume and transcript. Note that in the application system, you may upload an unofficial graduate transcript for the purposes of the application. If you are offered and accept a fellowship position, you will then be required to provide an official graduate transcript. In addition, when you enter your graduation date, if you have not yet graduated, you will be directed to enter your faculty advisor information. In part 3 of the application, you will have the opportunity to generate an email to your faculty advisor simultaneously for your references. Verification of your graduation date from your faculty advisor must be received prior to the application deadline. You should be sure to talk to your faculty advisor before the application deadline so that they are aware and will be prepared to respond. Step 2 is also where you will upload your resume and graduate transcripts. Step 3 is My Application. This is where you will select positions you are applying to and upload your essays, as well as enter the information for your references. Under the first essay prompt, you will see a list of training opportunities for the fellowship program. If you are unsure which opportunities you want to apply to, refer back to the program announcement, which includes details about each position. You will apply to the position if you are interested in by uploading an essay to that position. You may apply to a maximum of 3 positions under each fellowship program. The system will not allow you to upload more than 3 essays per program. So to clarify, if you wish to apply to both CDC and EPA programs, you may apply to 3 positions under the CDC and another 3 positions under the EPA. Applications are separate for each program. Further down the page, you will see the second essay prompt. This prompt is unique to the program, so EPA will have a different one than CDC's. The reference section is at the bottom of section 3. This is where you will enter the contact information for the 2 people who have agreed to write your letters of recommendation. There is no restriction on whom you may request to be your reference, but as discussed earlier, they should be people who can speak well to your experience and qualifications for the program and the positions that you are applying to. In other words, they should know you very well. You will also see at the bottom of the page a newly implemented feature, the Send Now button. With this new feature, you will have the opportunity to generate emails to your faculty advisor if you have not yet graduated and your references before submitting your application. If you do not click Send Now in the application, the emails will not go out until you submit your application. The deadline for your faculty advisor and references to submit their pieces is the same as the application deadline. Therefore, we highly recommend utilizing the Send Now feature to generate the emails before submitting your application so that your recommenders can have time to submit before the deadline. In step 4, you will review your entire application. If you need to make any changes, click on the pencil icon next to the section you want to revise, and it will take you back to that section so that you can make any changes that you desire. The last and final step is to submit your application, which is step 5. Check the box to electronically sign your application, then hit the submit button. When your application is successfully submitted, you will receive a confirmation email. At the time of submission, the system will automatically generate emails to your references and faculty advisor if you have not already done so using the Send Now button that we just reviewed. Please remember that saving the application with that information will not generate emails to your references nor submit the application. You must hit the submit button for this to happen. Once you have submitted your application, you may still make changes to it at any time prior to the deadline. You will do this by rescinding your application from your homepage by clicking on the pencil icon under My Status. A box will pop up and you'll click the rescind button. Just remember, if you rescind, you must resubmit your application by the deadline or it will not be reviewed. ASPPH will not make any exceptions for incomplete applications. This includes missing information and submissions from your references or faculty advisor. Once again, the application deadline is also the deadline for them to submit these documents. To reiterate, on this page, under the My Status section is also where you will see if your recommenders and advisor have submitted their materials. You should monitor this prior to submitting your application so that you can see if a friendly reminder is needed. Once the deadline has passed, ASPPH will review all applications for completeness and eligibility. We will update you of your status in the system when your application has been verified and moved along to the review stage. You may view your application status at any time that you are logged into the system. The system will also automatically send you an email update when you have a change in your application status. I will now hand the presentation back to Monica.
Great, thank you. Oops, I'm going a little crazy with my, I apologize. That's where I am. Okay, thanks again. So ASPPH ensures that all eligible completed applications submitted by the deadline will be reviewed in an open, fair, and objective process. Each application will be reviewed by 2 faculty or staff members from ASPPH member institutions, but not from the same institution as the applicant. Applications will be scored according to the criteria noted in the program announcement, and the top applicants will progress to the next phase, which is the technical review. During the technical review, applicants may be contacted for interviews directly by the agency. Moving on to the technical review phase does not guarantee that an applicant will receive an interview, only that the application has been sent to the placement agency for final review. It is possible that not all applicants in the technical review phase will receive interviews. In addition, for the ASPPH EPA fellowship program, there's the middle step, which is for the formal panel interview. The interviews will be held virtually via Zoom in April. All applicants who advance to this stage are required to participate in the panel interview in order to be considered for final placement and the technical review phase at EPA, which the top applicants from the interviews will be sent. Now, individuals selected for positions with each program will be contacted directly by ASPPH email, via phone and email. Those applicants who are not selected will be notified by ASPPH by email. The timeline for each program does vary, so please be sure to refer to our website and the specific program announcement to review important dates for the program in which you are interested. And just to reiterate, the formal panel interviews are for applicants for the EPA fellowship program only. Now, information regarding ASPPH fellowships is available through your own career services and/or student liaison offices at your school or program of public health. In addition, you may also easily access information online, including all application deadlines and detailed application instructions on our website, asppph.org, as well as the Fellowships and Internships page, which is located under the Workforce Center section of the ASPPH website. Or you may simply search online for ASPPH fellowships. You can also go directly to the fellowships application portal where you can create an account and apply. Lastly, a great way to stay up to date about training opportunities is to subscribe to the ASPPH Friday letter. We announce all our fellowship openings through the ASPPH Friday letter and advertise partner opportunities as well. So it's a terrific resource if you're interested in any type of applied learning and training program in public health. So before we start, a few housekeeping details again. You may click on to your Q&A section or at the bottom of your screen to ask any questions to any of the candidates, any of the presenters today. So I'm going to go ahead and stop our share. So you can see all of us. So if everyone can come off of, there we go, wonderful. Now we're going to look, and so there are no questions so far. And so right now I'll give all of you a little more opportunity
There's
to,
questions in the
oh, here we go. Oh, here we go. Yes,
Q&A.
wonderful. Thank you, Sierra. So yes, this will be recorded and it should be posted on our website by the end of today, but definitely by the end of tomorrow. So once that's on, we encourage you to rewatch if you'd like, or absolutely please share with other friends or colleagues that you think might be interested in the program. So yes, it will be available online no later than end of day tomorrow. So what else? So to confirm, are there any opportunities or suggestions for recent undergraduates. So this is something that's been on our mind quite a bit at ASPPH. And that's one of the reasons why we recently changed our branding from graduate training programs to simply applied learning and training. And that's because we are currently making a concerted effort to work with partners to hopefully provide opportunities at the undergraduate level in the coming years. So right now, unfortunately, we don't have anything, but we're working on it. So I encourage you to stay the course, keep moving forward with your education, keep in touch with ASPPH and stay aware of all of our, like through the Friday letter and come back to our website often. And we hope to have something available for undergraduates within the next year or so. So can we get the slides after the webinar, please? Unfortunately, no, the slides won't be available, but the recording will be. So you will have access to rewatch and share the recording. So for international students, I am from Pakistan and I did my MS in biostats and epi from the School of Public Health at the Dow of Health Sciences. How may I know if my institute is a member of ASPPH? You can go on to the ASPPH website or just simply search ASPPH members and all of our member institutions will be listed there. If your school does not show on that list, then unfortunately you are not eligible. And thank you, Sierra. It looks like Sierra is adding the link there for you in the Q&A. Again, another question about the slides. So is it needed to reside in Atlanta, even if remote options provided also need to be worked? Okay, so for the CDC program specifically, they are definitely more open to remote work. As Michael can attest, he actually does his fellowship remotely from Chicago, but he visits Atlanta on a regular basis. So he spends a lot of time with his team and his mentors there in Atlanta. He has his position has a travel and training budget that does allow for that. Not all fellowships do, but most do have some type of travel and training allowance, especially if they do expect you to come to Atlanta frequently. Otherwise, I know that for our EPA fellowships, they're on the opposite end of the spectrum where they're really pushing to have fellows in person here in Washington, D.C., or wherever, like I said, we have in the past, we've had fellows based at RTP in North Carolina and other regional offices. So wherever that position might be based. And for USDA, they are considering applicants who need to work remotely, although the position is based here in Washington.
I can add to that too.
Sure, Tamara.
Yeah, so when I started my fellowship, it was technically like remote, but I dipped into my savings and made the move to DC just because I realized that a lot of the opportunity and networking is here in DC. And so there's a lot more opportunity to just go to different conferences, to speak, to network. So if you have the funds or the means, I would definitely recommend making the move. I made a lot of different connections throughout HHS with the VA, different councils. So I couldn't, express more that to make the leap of faith and just come to DC.
It's a fun place to be too. But thank you for sharing that, Tamara. But also on the opposite end of the spectrum, because I don't want to scare folks away from doing a remote position. Michael, do you want to speak a little bit about how you've been able to make the fellowship succeed for you, even though you're remote?
So I'm originally from Chicago, and after I finished grad school, I moved back because the fellowship did allow me to work remotely. But like you mentioned, both of my teams did realize the importance of being in person and attending, certain events on campus. So my fellowship does allow for pretty frequent travel to Atlanta. And I think I go 2 months, which has been really, really nice. But a lot of opportunities, and speaking from the CDC side, are hybrid in a sense that they do have opportunities for you to attend certain webinars or conferences or large center events in a remote option as well. So you definitely do get that experience of being a part of whatever's going on in Atlanta. But like Tamara did say, if you do have the opportunity to be in Atlanta, I think that's also a great opportunity to further increase that networking and opportunities that you have in person. But being remote, it really just does depend on your host site and the funds that they have available for you to either visit your campus if it is in Atlanta, or we have some that are in Colorado or some that are in Puerto Rico. So it really just depends on where you end up and the funds available, but either remote or in person or maybe a hybrid, you get so many opportunities.
And for the CDC positions that will be announced in January, on each project description, it will state whether relocation is required. Because there were, like Michael said, we have one fellow who's based in San Juan, Puerto Rico, and she is absolutely required to be in person. So she did need to relocate for that position. So, but if it will accept a hybrid or fully remote position, it will be stated on each position description. So you'll have that information available to you at the get-go. So we have another question about the fellowship support for underrepresented people of color. So ASPPH, so since our program with CDC is our most long-standing program. So since we have had that the longest, and it has been by far our largest program, we typically use that as our model for other programs. And under the CDC grant, it explicitly stated under this current cycle that we were to build a more holistic review process. So we've done that. We've been working with some advisors and consultants at our member institutions who specialize in DEIJ. And they've helped us develop this more holistic review strategy that takes into consideration applicants from the BIPOC community and other underrepresented, I'm sorry, I can't speak right now, underrepresented and marginalized communities. So that absolutely is a priority for us, and we are making every effort to capture as many applicants for those communities as possible to add them to the pool that our colleagues and our partners at the federal agencies have to choose from.
And then to answer the second part of your question, just as an example from this last class of CDC fellows that were selected, 3 of the 7 identify as being persons of color, just to give you an idea.
Yeah. And I believe the percentage, so the year before we brought on, I believe it was 23 new fellows. And again, I think it was at least 50, I think a little more than 50% identified as part of a BIPOC community or other marginalized community. So we do, and those are the selected candidates. The application pools mirror that pretty closely. So we are working very closely with our host agencies to translate that those application pool stats over to selected fellows. So the next question is, can an enrollment letter confirm the graduation date rather than providing faculty advisor information? Unfortunately, no, we do require you to input faculty advisor information so that we can easily reach out to somebody if necessary. Then which would be more highly recommended by the fellows, a CV or a resume? Given that a CV traditionally contains all past experience compared to only brief and most relevant highlights in a resume. It's really up to you. We don't have a preference of one over the other. It really depends on your preference and which tool will best represent you and your experience. So we definitely leave that up to the individual applicant. So will your academic advisor need to approve our graduation date for every application? For every program, not for every position. So for example, our applications are separate. It's the same system, but a CDC application versus a USDA application versus an EPA application, there are 3 different documents, right? So if you apply to all 3 programs, they will need to go in and verify your graduation date under each separate application. I hope that answers your question. Okay, so is there only one fellow selected per program? So for USDA, there will be 1 fellow. For for CDC, we believe, at least from the most recent notification, we believe there will be 15 positions this coming year, but that hasn't been, that's not set in stone yet, but it should be around 15. For EPA, it works a little differently. For EPA, we won't know the actual positions later until a little further along the process. We will know probably, so essentially you're going to be, for EPA, you're going to be applied to training areas. Whereas for USDA and CDC, you're applying to actual position descriptions. And so what that means is for EPA, for example, you will apply to the areas in which you want to pursue further applied training. So whether it's water quality or environmental justice or children's environmental health or climate change, those types of things. And then a little further in the office or in the process, the offices who are looking for fellows under those areas will look at those applications. And the reason why we do it that way is because EPA has found that it allows their offices a little more time to secure funding to support these positions. So, so that's why it works a little differently. So you won't know exactly what positions you're being offered until you're already pretty well into the process. So during the applications, you're simply stating the area or areas that you wish to pursue. And again, you'll be allowed to apply to up to 3 different areas. So if you want to apply to environmental justice, children's environmental health, and sustainable communities, you'll be allowed to submit applications under all 3 of those areas. So Tamara, there's a question for you. With being the inaugural USDA fellow, what projects are you wanting the incoming fellow to pick up once you leave and maintain the progress?
Great question. There are a lot of different projects because you are a team of 2. So off the top of my head, some of the projects the fellow will continue on. So I supported, you're on a lot of different interagency working groups within the federal family, we like to say. This last year, we had finalized and published the National Strategy for Suicide Prevention that had its first ever federal action plan. And so I led and developed the USDA's action items for that federal action plan. With that, there is quarterly reporting needed by this interagency working group that goes up to the White House. And so you will be in charge of doing those quarterly reports. So that's going to be working across the entire department with your key colleagues that are in charge of their action items. You're supposed to, mentor them, support them and what they need, make sure that they're on progress to complete those action items, whether it's, this will be year 2 or 3. So that will be ongoing. You'll be leading a department-wide USDA mental health and farm stress working group every month. With those, I've developed the structure. Of course, the fellow can change it, but you kind of connect with the other USDA departments or offices or agencies that are involved in that working group and kind of support them in providing a deep dive presentation on what's going on. This is also an area where those action items can be discussed. I started a research project. So during COVID, some of the ARPA funding that went to USDA went into their what they call the Emergency Rural Healthcare Grant. There were 2 different tracks, track 1 and track 2. Track 2 had an evaluation tied to it because those were going to be more impact-oriented funding opportunities. Track 1 was for immediate relief that was dispersed throughout the nation. So that kind of went to, PPE gear, or maybe it was purchasing a refrigerator in a rural clinic to have vaccines. varies a lot. So with that, I did a exploratory analysis based on that data, which was great. I presented at APHA and the Rural Sociological Society on that research. So, but I received the okay to continue that on to do more of an impact research. And so with that, you'll be doing a mixed methods research with those recipients. So focusing more on that qualitative data. And so we are designing that in the next month. So that will be continuing on.
Sorry to cut you off, Tamara. We're
I
actually,
know,
we're
sorry.
at
There's a
time.
lot, but I'm happy to follow up.
Yes, I'll answer one more question very quickly because it's pretty simple about the essay prompts. Each application, USDA, EPA, and CDC, they all had 2 essay prompts, as we discussed earlier in the presentation. Yes, you are required to do both essay prompts. So if you're applying, and if you're applying to more than one position under a program, you can have up to 4 essays. So 1 for each position. So if you 1 to 3 essays under the first prompt, and then for the second prompt, it's a single essay. Okay, so yes, and please remember training programs at ASPPH.org, and let me bring up, I apologize, I'm sharing this. This is our contact info down below, training programs at ASPPH. Sierra and I monitor that email. So if we didn't answer your question, please feel free to reach out to us at that email address below, and we will get back to you as soon as we can. So this ends today's webinar. I thank you for joining us, and I apologize for going over the time limit a little bit, but I wish you all very happy holidays, and thanks again, and I look forward to receiving all your applications. Take care, everybody. Bye-bye.